The following segment is sponsored by Northwest Honda Dealers.
It is an important day here at KATU. Today we launched a new project called Kind is Better. Our hope is that the project will help remove the stigma around mental health issues and give parents a better idea of what it's like to be a kid in 2018. As we showed you in the last half hour, it can be hard to find help. So joining me live on the set is Zakia Elazami, a high school senior and a volunteer with YouthLine. Thank you so much for being here with us today.
Thank you for having me.
So share with us what you see as some of the biggest things contributing to mental health issues for young people and some of the people that you talk with.
I think that one of the big things is just increasing levels of stress. There's a lot of stress to do well academically. You have college ahead of you. You have all kinds of things going on, and then not to mention social pressures and the added pressures of maintaining an image on social media and things like that. But I think it's also important to remember that mental illness has always been a big challenge for young people and adolescents, and it's not a new thing that's cropping up recently. It's something that's been around and been relevant for a long time.
You're bringing up some key points because I think we've all had mental health issues. Like you said, it's been around for a long time, but kids now live a very different life than how I grew up. Let's talk about how comfortable kids are talking about mental health.
I think that there's a lot more awareness around what mental health is and how it's a valid illness. It's not a weakness or a sign of failure, but I think that we're still missing the ability to discuss mental illness seriously. And I think we're still missing the ability to be able to advocate for treatment and for the help that you might need.
So how do we get there? How can that improve?
I think the biggest thing when you're talking about youth mental health is just because young people are in a position where you don't necessarily have the agency, be it financial, or you don't have the means of transportation that adults do, but you face some of the same stressors when it comes to mental illness. So I think the biggest thing that we can do as a community is just learn how to listen to the young people around us and learn how to take them seriously and learn how to acknowledge their problems as if they were as valid as anyone else's.
You brought up some of the obstacles that maybe young people have when it comes to getting to a resource. Are there enough resources for teens, for kids, for young people?
Honestly, I don't think there are. I think that we can't say we have enough resources until we can say without a second of doubt that every single young person in the United States would have access to mental health care if needed. And the reality is, unless you're from a middle class or upper middle class background, it's going to be difficult to pay for mental health care or to have the flexibility in your schedule to be able to have mental health care. You need to have parents that are able to drive you to a therapist, parents that are able to pay for a therapist. If you don't have good health insurance, sometimes it can take up to 6 months to a year to get in to see a therapist, which is a long time to ask someone to wait for medical help.
So are adults doing enough to make sure kids know about the resources out there?
I don't think they are. I think that because adults, especially parents, have such a big weight put upon them and put so much stress on themselves for their children to do well and to flourish. And so sometimes I think it's easier for parents to brush some of those issues aside instead of reassuring their kid that it's okay to feel like this and it's okay to ask for help.
You're very well spoken. Are you comfortable talking about your mental health?
I would consider myself comfortable talking about my mental health, volunteering in YouthLine and being in an environment and a place where it's important to talk about your mental health and important to talk about your struggles and how you overcame them. I mean, the issue of mental health is something that's still very real for me. It's something that I continue to struggle with and probably will continue to struggle with my entire life. But I think that being able to talk about it in an open way, in a non-judgmental way, makes it safe for the other people around you to discuss what might be going on for them in that way. And I think that that's an attitude and that's a conversation that can potentially save someone's life.
Zakia, thank you so much for joining us today and giving us some insight as well. We really appreciate it so much. YouthLine is just one of the important numbers we've compiled for you. There is also the National Lifeline. Their number's on your screen, 1-800-273-8255. To get a hold of YouthLine, call 877-968-8491. And this is really cool. available as well. You can text teen to 839-863, and we'll be sharing all of these numbers a lot with you. We hope you'll write them down, even if you don't think you need it today. Thank you so much for your time.
Thank you.
Good articulate discussion there. We're launching a new website with this program called kindisbetter.org. That's where we'll post all the stories we've done along with mental health resources for kids. It's also a good way for you to share your story ideas about mental health, bullying, or how you're using kindness to make your community a better place. It's all at kindisbetter.org.